County. First, can you tell us how many cases there have been since school started?
Now, since we've started school, we've had approximately 10 cases, those being employees in various positions. And so, depending on the time that they occur, it can have a different impact on what happens at school.
And that's since August?
Yes, since the August time frame. About the school. It has everything to do with if we have enough faculty and staff to properly supervise children. So if we have a case that's positive, we have contact tracing that cause too large of a number of people to be out, but we can effectively supervise all the children. So we have to revert back to virtual learning. Have all of those people that have been affected go through the protocol with the health department, determine when they can safely return to work. And when they can do that and we have an adequate number, then we can have school in person.
Okay, I'll ask another one. I don't know if you guys want to take turns asking questions here.
So, are the cases of COVID-19, are they contracting it in the schools or outside of the schools? Could you tell us about that?
And so that's a very good question. We haven't had any cases that have actually been contracted in the schools. What we have is that every other institution or private company has a person engages in some type of activity outside of our workplace, and then they come to school and they've been identified as positive. Then we have to go through the process of doing the contact tracing. So we haven't actually had any cases that have been transmitted as a result of school. It's been all about someone engaging in an activity outside of school and then returning to work. Therefore, it's possible. Very good.
And the same thing with the exposure. The exposure, is that in the schools or outside the schools?
And so we haven't had any cases where we've identified exposure in schools. We've had people that have been in similar locations outside of school at similar events, if you will. And the person is ended up being positive. Another person may test positive at the same event. So nothing has been transmitted at schools that we are aware of. We'll have situations where when cases are identified at a location within a certain period of time, it can be classified as an outbreak, even though it's not an outbreak as a result of that location.
So if I am correct, the next phase of school was supposed to start yesterday, correct? Did that happen where elementary was in Plan A and high school, middle school started Plan B yesterday?
Absolutely. So in Bladen County, we had our primary schools, which are pre-K through 4. Students would be able to come every day except for Wednesday, which is our deep cleaning day. And then they would not have the social distancing restriction within those classrooms. And then grades 5 through 12, they would come also on the 19th, which was yesterday, A day and B day. Absolutely.
So is there any thought of maybe changing that to go back, backwards a step just because of everything that's happened?
What we've decided is that every time we make a change, it'll be based on data and what's available. And so at this point, we don't have any plans of changing what we're doing with student attendance or school attendance. But at any point, the metrics change where cases go up, or if we don't have the available employees where we can host school, then we would certainly make a change and move backwards if necessary.
So what kind of procedures are being done now that those 3 schools are closed? What's being done inside since it's empty?
Well, the students are on virtual learning, and so we want to remind everybody it's not that the school is infected, it's just a simple fact that we don't have enough staff available to operate the school, properly supervise children, and provide proper instruction in a face-to-face setting. So as a result, we end up going to virtual. So those students are still in school, those teachers are still working. It's just all being done virtually like we did at the beginning of the year.
So is the school being cleaned at all in some kind of way or anything?
Yes, if there was any situation where we needed to go in and do deep cleaning, we've done that. In many of the situations, we haven't had to do any cleaning at all. It was the simple fact that those employees were either identified as positive before they came to school or someone in contact tracing. So we do the daily cleaning, we do the deep cleaning on a Wednesday, and anytime that we have a hot situation, then we will have a cleaning team that go in. So we've had hot cleaning situations at several junctures throughout the year. So I think the first one back in August, just kind of going through it after those times.
Let's say, the 2 weeks is up and those employees haven't tested negative yet. Are you going to extend the closure of the school?
Well, and that is the purpose of the 2 weeks, that by the end of that period, they will have been cleared by the health department and be in a situation where they can come back to school. So the only reason that we can make a change is if someone at that location contracted the virus, or they were a primary for a case that may have had nothing to do with the school, and then we won't have enough employees. So an example would be, I could go to a football game and end up being positive and can't return to work. I work at a location, that's going to impact that location. So as long as we have enough employees to operate school, that's what we're doing.
Are you having employees say that they're too scared to come, and that's why it's not that necessarily that they've been exposed, but that they're scared to come back?
Absolutely. People are scared all over the country. We've certainly had employees to express their concerns about their safety. But what we've reassured them is that we're taking all of the safety precautions, all the necessary protocols to make sure that they are safe. And I haven't had a single employee to refuse to come to work. And so we want everyone to express their concerns, their feelings about being safe at work, but no one is refusing.
And how can parents help the school system and the teachers during this pandemic?
What I would say to parents is that when their children return to school on the days that they are assigned, that they follow the protocol, that they do not send their children to school sick. If you are aware and know that your child has the illness, one of the what we would call identifying factors, a cough, runny nose, whatever the case may be, a fever, don't send your children to school because situations that all schools run into are children that are sent to school by their parents. They will pass the temperature screening, but they still have the other underlying conditions, and then we discover them, and we end up having to put children in isolation and try and get other things. So imagine if a parent is at work, it could be 2 or 3 hours before they get to that school to pick their child up. So I would say follow protocols, don't send your children to school sick, and to employees in the school district, don't come to work if you're feeling sick. And this is what I would urge everybody in our community, whether it's with the school system or with your private company or whatever the case may be, if you are feeling sick, then you need to isolate yourself and do not put yourself around other people and put them in danger at risk.
Dr. Taylor, I think you also may want to emphasize the point that having staff out of the building is not entirely related to a COVID incident. We do have staff that are out for other reasons, so that is part of our factoring in whether a building can be fully staffed.
And so when we think about employee availability, we have employees out all the time that have absolutely nothing to do with COVID. If someone is on maternity leave, they're going to be out anywhere from 6 to 8 weeks. If someone has a medical condition, surgery, things of that nature that take place, then they're going to be exercising what we call FMLA, leave. So that causes people to be out. So when we look at the availability of employees, we do want our community to understand that it is not 100% COVID. We could have 6 faculty members that are out at a large school, and then others that are out due to contact tracing or infection. And when you combine all of those things, that makes it difficult for a school to be able to supervise children. We had a conversation with a principal yesterday, and we probably brooded for nearly 2 hours to determine whether or not we were going to really try and open school. And the principal tried as much as they could to figure out how we could have coverage. But when you have entire grade levels, only one teacher at grade level, it almost becomes impossible to to have instruction and safely supervise children.
Thank you.